we're diving into the world of medical diagnostics to explore the Antisynthetase Syndrome profile test. If you or someone you know has been experiencing symptoms like interstitial lung disease, myositis, Raynaud's phenomenon, or arthritis, this test could provide crucial insights into your health. Pre-test information. Let's start with some pre-test information. One of the great things about this test is that no special preparation is required. That means no fasting or dietary restrictions. Just show up at your scheduled appointment and let the experts take care of the rest. Specification of the test. Now, let's talk about the specifications of the test. The Antisynthetase Syndrome profile test is specifically designed to detect antibodies directed against an aminoacycl transfer RNA synthetase. These antibodies are often associated with Antisynthetase Syndrome, an autoimmune condition that can affect various parts of the body. Disease associated with the test. The clinical features of Antisynthetase Syndrome include interstitial lung disease, myositis, Raynaud's phenomenon, and arthritis. However, it's important to note that this syndrome can overlap phenotypically with other conditions like polymyositis, dermatomyositis, and inflammatory myopathies. Specimen used. Now, let's talk about the specimen used for this test. Typically, a blood sample is collected from the patient and sent to the laboratory for analysis. This blood sample contains antibodies that can provide valuable information about the presence of Antisynthetase Syndrome. Components of the test. The components of the Antisynthetase Syndrome profile test include various assays and techniques that specifically target the antibodies associated with this condition. These components work together to provide accurate and reliable results. Test report time. One of the most common questions people have about medical tests is how long it takes to get the results. Well, the good news is that the test report time for the Antisynthetase Syndrome profile test is typically relatively quick. Depending on the laboratory and workload, you can expect to receive your results within a few days to a week. Understanding Antisynthetase Syndrome. Now, let's delve deeper into Antisynthetase Syndrome itself. This autoimmune condition occurs when the body's immune system mistakenly attacks its own tissues, specifically targeting the aminoacycl transfer RNA synthetase enzymes. These enzymes play a crucial role in protein synthesis, and when they're attacked, it can lead to a range of symptoms and complications. Higher prevalence of interstitial lung disease. It's worth noting that there is a higher prevalence and increased severity of interstitial lung disease in patients with Antisynthetase Syndrome compared to other conditions like polymyositis, dermatomyositis, and inflammatory myopathies. This underscores the importance of accurate and timely diagnosis through tests like the Antisynthetase Syndrome profile test. Conclusion. So, if you're experiencing any of these symptoms or if you've been diagnosed with a related condition and your symptoms are worsening, don't hesitate to talk to your healthcare provider about the Antisynthetase Syndrome profile test. Early detection and intervention can make a world of difference in managing this complex condition. Thank you for joining us today. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. And as always, stay healthy and informed. See you next time.